up earlier as well. Madam Vinny, maybe I can bring you in here. One of the startling statistics which I read was to say that with the heat waves incurring, women will have to travel far further to be able to access water, right? And sometimes that can average walking close to 16 kilometers a day sometimes. When we're thinking about localization of strategies and taking it down there, how do you see the policies around providing access to water, taking into account these gender impacts that we're going to see with climate change?
So on drinking water, I think the good news is that after decades of efforts at getting water into habitations, there is now an ongoing program for getting water into the house in a saturation mode. And we've had already a very substantial achievement in that regard. So in terms of the time spent walking, I mean, WHO's figure is that after every household gets access to drinking water, thanks to Jal Jeevan Mission and of course Amrut in urban areas, the savings in the time spent on fetching water would be 6.6 crore hours every single day. 5.5 crore hours out of those are for rural India. And I was actually pleasantly surprised that 25% of that is for men. So it's only 75% by women. I thought it would be 99% by women, but be that as it may. So I think there is recognition, and there are therefore a lot of programs ongoing that would have the impact of mitigating for climate change. So for instance, in the Jal Jeevan Mission, India has traditionally been using groundwater for drinking purposes, okay? So in 2019, 85% of households received drinking water from groundwater sources. But once Jal Jeevan Mission sort of asked of the states that they must ensure sustainability, state after state after state started coming up with surface water-based schemes, leading to a humongous increase in costs, also meant time overruns, so we are still at 78%, not 100% where we should have been. But I think there's a clear recognition, and the impact of climate change has brought the spotlight very much there. And so, like I said, a huge movement because groundwater is not sustainable. So let's get conjunctive use or surface water use. So that's one. But if I could also, I mean, you may not give me the opportunity again, so let me just grab it. I sense in your remarks a very deep concern about the role of women and girls and how they continue to be amongst the most underprivileged. And without in any way wanting to belittle that concern, I dare not do it. My daughter will pop me on the head as soon as I get back if she comes to know that I did this. It was from her for the first time that I heard the term manel, for instance. And this is quite the opposite, so I don't know what we would call this panel. But I have seen that women are actually on ground, and especially in rural India, very active, very vibrant. It varies from state to state, certainly. But you go to Rajasthan, they would have a ghungat, but they'll still, want to take selfies with you. They will still want to tell their stories. We're seeing women in the wash sector coming so aggressively, driving the e-rickshaws, doing all of that proudly. But much before that also, from the days when I was DC Roper long years back, the Total Literacy campaign, it was actually led by the women. It was the women who were coming forward because they felt they'd lost out by being illiterates. Much harder to get men into it. So I think let's not get too upset. Let's remain sufficiently upset to make sure that we continue to give our attention to the issue. It is a serious issue. But I think I see strong undercurrents of very vibrant activity amongst women. I see in Jharkhand, girls coming up in a village, coming up and talking about how they're dealing with their menstrual pads in a room like this. And I think back of the time when I would be too embarrassed to buy a menstrual pad or even talk about it, with my male IIM Calcutta classmates. I'm talking about that age group. So there's hope. There's hope. There's a lot of vibrancy. There's a lot of energy. They're just, you do need to, of course, provide opportunities. By you, I mean the system as a whole. But things are good. Things are good and will get better.
No, definitely. A lot of progress has been made, and I didn't mean to belittle that in my opening remarks. So sorry for all the alarm bells around it. Shagun, do you want to come in here? Because you also talk a lot about access. You mentioned menstrual pads, but you also have done a lot of research around how access to sexual and reproductive health services, especially during disease outbreaks or natural disasters, sometimes you see a complete breakdown of the system, and women really struggle in that. Do you want to come in and comment on that about how that's going to be affected with climate change and what can happen?
Yeah, absolutely. I think there has been so much of the discourse that's focusing on the impact of climate on health, and there is now clear linkages between sexual and reproductive health. Some of it is direct, like your services stop, you don't have any ways of going, but also due to the economic burdens, there are many other unintended consequences that happen, right? Violence goes up, and there are many other things that happen. At the same time, I feel there are certain groups even now in our community that are really not being able to reach the system. And actually, ma'am, you had the first time when we were working together, it was like the migrants group, right? They are always cut off from even the basic services of vaccines. They're not a part of any system. And there has been a lot of work since the pandemic to really push on what's happening to these migrants. Climate change is going to lead to such increases in migrants all over the internally displaced populations, right? And I think for their health needs, especially the women, it becomes very, very important that we start to plan and we start to have a coordination mechanism, because this is not going to just having that sectoral approach or just the health department will not work. The second thing I will say is that there is now a lot, the climate science itself, the climate science piece of it is somehow in a way so alienating that bureaucratic it's not something that can be translated very easily by the people who actually need to know that, right? So even being able to predict what's going to happen using data and then aligning your systems accordingly is something that's not being looked into. And again, health is the department that has to kind of really work on it, but it doesn't have to be the coordinating department. So there is some work that happened in Bangladesh last year, actually, some very good examples of how different departments coordinated, came together to look when the heat waves were going on, and there was a coordinated response. So I think what I'm trying to say again and again is that even when we look at it from a rights perspective, it becomes very important in climate to keep bringing the systems perspective. Who is the system consistently not being able to bring into their fold? That's the only way you can deal with the climate crisis, right? And climate will become the norm. The heat is going to continue to increase. So how can our health system start to respond to that, is what I would say.
Aditya, do you want to come in here and just talk about how do you have a sense of who we're not delivering for, the data systems around it? In your book, Resilient Reset, where you talk about how it cannot be business as usual anymore. We need to relook and look at new data forms to be able to capture what's been unseen before. Can you talk to some of those ways that it's working successfully in some countries?
Sure. I think good quality data, as we all know, is the foundation for effective action. And in the book, what I try to do is just to step back and see how the data landscape is evolving when it comes to thinking about climate risk. And if you break climate risk down into its three essential components, we have exposure, which is, say, if a cyclone is coming, who stands in the path of a cyclone. We have vulnerability, which is who's likely to be most affected, who has the resources to withstand the cyclone. And then we have the hazard itself, which is how intense is the cyclone, how fast it is. In each of these three components, there are some pretty startling developments in the use of AI, large language models, machine learning, big data to try and track these approaches. I'll give you just a couple of examples to illustrate how this world is changing. So if you think about vulnerability, and let's take food security as an example, it's very difficult. You have to do, you can kind of predict when there's going to be food scarcity in certain parts of the world or certain parts of country. Then usually you have to go in and do some kind of house-to-house surveys to see what's happening. You take measurements, you figure that out. It's very expensive. It takes a lot of time. Many times by the time support arrives, it's too late. We've lost a lot of lives. And so one really interesting initiative that is partnering with the WFP in East Africa, they've, through real-world calibration, developed an algorithm that relates cell phone airtime recharge top-up information with food security. Essentially, what they've determined to a high degree of statistical certainty that if a household is topping up their cell phones below a particular threshold amount, at that point, they're almost certainly not consuming the amount of calories that they should be. And this is transformational for how you deliver food aid. And as we know, one of the biggest impacts of climate change is going to be on food security. Let me give you another example, totally different. I work a lot on issues of urbanization and climate resilience. One of the biggest impacts of climate change in urban context is going to be heat. I don't need to labor the point, but almost 500,000 additional deaths a year are caused as a result of extreme heat. Last year, 6.3 billion people were exposed to 31 days of extreme heat around the world, so it's a huge issue. However, in cities, it's very difficult to understand how hot different parts of a city are going to be, because unlike in rural areas, cities, the temperature changes block by block, neighborhood by neighborhood, depends on how high the buildings are, how wide the roads are, how many trees there are. So to overcome this problem, one initiative in the US, they've developed a system through which they can correlate the temperature of the battery in a cell phone to the air temperature around it. So they've developed a relationship where if your battery is at 20 degrees, then the air temperature is at 18 degrees. And every cell phone in the world is constantly monitoring its battery temperature. So now they're acquiring extremely precise air temperature data from 500,000 mobile phones spread across the US. Not only does it give you real-time information, over time, what it gives you is the ability to model heat waves. So you can say that if there are 3 days of 24 degrees temperature in New York in the first week of June, almost certainly you can expect a heat wave in the third week of June. And this has, again, transformational impacts, because no longer will a city have to set up cooling centers throughout the entire city to cater to 20 million people. You can actually target the most vulnerable effectively. One more example, then I promise I'll stop. Which is, when it comes to vulnerability, understanding the ability of households and people to withstand different shocks and stresses is again quite difficult. Traditionally we've done it through participatory approaches, through household surveys, all of which are valid. But in Mexico, they tested a whole new approach. They took data from point of sales machines and ATMs before the cyclone season to see consumer behavior in different parts of one region of Mexico. So they were able to determine through that who is taking out cash ahead of the cyclone, who is able to stock up on water, who is able to buy essential food items through that, and actually pinpoint neighborhoods that were able to cater for them, their own needs, and neighborhoods that were not, in order to target support much more precisely than they have in the past. So I don't mean to sound like a big data evangelist because of the issues that Shagunji has outlined, but I do want to state that I think the time has come for us to take these approaches very seriously and start to mainstream them in decision making.